Greetings, Simplicity viewers. When it comes to health, we have a lot of queries, especially queries related to heart diseases. Today, we have Dr. Rajpal Abeychand with us, a senior cardiologist at GKNM Hospital. He has pioneered transradial angioplasty, that is angioplasty through hand. Let us understand heart-related issues from him much better. Thank you, sir. Thank you so much for joining on our show.
It's a pleasure.
There is a lot of myth-related queries when it comes to cardiology, especially with the heart attack. So what exactly is the reason that heart attack generally occurs?
See, the cause of heart attacks in any population, young or old, is multifactorial. It doesn't relate to one particular risk factor. Like usually it is multifactorial, which means that there are multiple risk factors involved. Like for example, like smoking is a very important risk factor. Family history of heart disease, the presence of hypertension, the presence of diabetes, and a lifestyle a stressful lifestyle also plays a role. But certainly, what as physicians we look at it, what are preventable risk factors? Say for example, somebody has a family history of heart disease, we can't do anything for that. So we look at preventative, like for example smoking. Cessation of smoking is mandatory. So that's a preventable cause. Hypertension, it's a preventable cause. You treat hypertension, you get better. Cholesterol, today we have simple drugs which get cholesterol down. So, and then of course stress does add to all this. But I would say in this list, stress will not be the first or second factor at all. It will be a little low down. Certainly it adds to the problem, I don't say no.
So stress is just like an added
Yes.
reason rather than being the core reason.
Absolutely. I would. That would be the best way to phrase it.
Correct. And there is a lot of myth that is associated that generally when you're obese, you are more prone to heart attack. Is that true?
Yeah, I would say there is truth in that statement. Again, because obesity doesn't come alone. For example, when somebody is obese, exercise is cut off. The natural obese person does exercise less, is able to exercise less. Understand?
Correct.
Because the mobility is less, the comfort with exercise is less, they get pain, joint pain, for whatever reason. So when exercise comes down, again, the cholesterol level tends to build up, and exercise is known to be cardioprotective. When somebody becomes obese, they say they purchase or they buy hypertension, they buy diabetes, they buy lack of physical activity. So all these add, and then therefore they are getting into they fall into a higher risk category.
Also, currently we're seeing that a lot of youngsters are becoming prone to a heart attack or a cardiac arrest, and we certainly sometimes hear that a 27-year-old or a 37-year-old died with a heart attack. Why is it that it is becoming more and more predominant? With medical science advancing, the age factor is coming down. Why is it that it is happening so much?
Yeah. See, there are 2-3 reasons. I would say the first and foremost is that today's youngsters have access to a lot of things. Like before, smoking was never rampant in the younger individuals. Use of tobacco in its various forms was not rampant in the younger individuals. This has become a disease. It's a disease in itself. The use of tobacco and the use of and smoking. If a youngster suddenly died, for whatever reason, we would not have thought of heart attack. But now the awareness in the society and medical community has increased so much so that we are able to pick up more youngsters with these heart problems, which we were probably missing earlier. So that's a second reason why. That is a reason why we think that the heart attacks are more in the younger age group. The third reason also is certainly the stress that the younger generation faces now. Certainly a little more. So I think that also adds to the issue. And then with all these eatery items and this mushrooming of
Convenient food
of quick fast foods, I suppose they also add to this. For each bottle of soft drink, of the aerated soft drinks, so many sachets of sugar are
Correct. It's 3/4 sugar and
Yeah, so
water.
lot of sugar. Now soft drink though is part of everybody's life. I suppose all these things add to, and stress also plays a role. I don't say no. I think it would be
A combination.
of everything.
And what is it that you'd like to sum up for a healthy lifestyle? To stay fit, to stay young. What is your advice?
No, I think a healthy lifestyle can only be achieved by, you must look at everything. You must look at diet. You must abstain from smoking, abstain from alcohol abuse, excess alcohol. You must look at exercise for the sake of exercise, not just a walk or something. A good physical exercise. You must take time to do this. And stress levels, yes, but that's something that is very difficult to control. But one should pay attention to that. One must take time off from work. It's very important. And at the end of the day, you must take the help of technology. For example, today there are people who are very careful with their diet. They walk around. They do the exercise, everything. But they are abhorrent to pills. They are abhorrent to medicine. Today, the medical field has taken such huge leaps and bounds that a few sins may be forgiven if you take your medication properly. Like suppose you have got high blood pressure, take medicine properly for that. Get it down. Your high cholesterol, take medicine for that. Why do we want to? There is this, some people believe that no, I won't take medicines. Medicines is not good for me. Today the medical field has reached such heights that they derive the best benefit from that. Like for example, any technology. Today you use the best technology to get what you want, right? You take your medicines, whatever it is, you will definitely have a less chance of getting into trouble. It's a combination of all these things which will help us, lead a more happy, productive and healthy life.
Thank you so much, sir.
Yeah.
Thank you so much for enlightening us on heart-related issues, because it just helps us understand things better.
Anyway, it was a pleasure talking to you, and thank you.
Thank you.